Hi all, I'm Dr. Malati, working as a professor in Triple M College of Nursing. So in this video, I'm going to discuss about the female pelvis. It is going to be a demonstration procedure for BSc Nursing, Post Basic and MSc Nursing students. The objectives are introduction, female pelvis, pelvic bone, pelvic joint, pelvic ligaments, types of pelvis, landmarks of pelvis, pelvic brim, pelvic cavity, pelvic outlet, diameters of pelvis, summary and conclusion. Coming on to the introduction, the female pelvis is a vital anatomical structure that plays an important role in reproduction, support of pelvic organs, and the process of childbirth. So, a clear understanding of a pelvic anatomy is essential for the nursing students, especially in the field of OBG. So, the demonstration of the female pelvis, it helps the students to visually identify and understand the different parts, including the pelvic bone like ilium, ischium and pubis, pelvic inlet, outlet, and important landmarks which is relevant to the labor and delivery. It is also aids in correlating the anatomical knowledge with clinical practices such as assessment of pelvic adequacy and management of labor. So this procedure enhances the students for the practical knowledge. It also improves the observational skills and also prepares them for effective patient care during antenatal, intranatal and postnatal periods. Female pelvis. So it consists of two parts. One is solid part, another one is soft part. Solid part is pelvic bone and soft part is pelvic ligament and muscles. Pelvic bone or usually this female pelvis, it consists of two innominate bone, one sacrum and one coccyx. Innominate bone consists of ilium, ischium and pubis. So this is the image of a pelvic bone where you can able to see a ilium, ischium and pubis. You can able to see the sacral promontory, iliac crust, anterior superior iliac spine, pelvic brim, pelvic bone, coccyx, ischial spine and sacrum. Ilium. It is a large flared out part. When we keep our hands on the hip, our hands rest on the bone called iliac crust. So at the front of the iliac crust, we can able to feel a bony prominences called anterior superior iliac spine, and a short distance below we can able to feel another prominence which we will call it as anterior inferior iliac spine. So anteriorly this ilium, it is concave in surface, we will call it as a iliac fossa. Next part is a ischium. So I told you earlier, this innominate bone consists of ilium, ischium and pubis. So first part we have discussed about the ilium. This is the second one, ischium. So ischium is the thickest bone. It is a middle part, thickest bone, lower part. And when we sit, our body rests on the bone called ischial tuberosity. So behind the ischial tuberosity, there is an inward projection called ischial spine. It helps to detect the station of the head during the labor process. So during the labor process, when we do the pervaginal examination, so it helps during the pervaginal examination, it helps to detect the station of the head. So how you can able to detect the station of the head? So at the level of ischial spine, you will call it as a zero station. Above to it, you will call it as a minus station, and below to the ischial spine, you will call it as a plus station. Then next point is the innominate bone contains a deep cup. It helps to receive the head of the femur called acetabulum, which is composed of, it is composed of 2/5 of ilium, 2/5 of ischium and 1/5 of the pubis. So the lower border of the innominate bone have two curves. One curve extends from the posterior inferior iliac spine up to the ischial spine. We'll call it as a greater sciatic notch, and the another curve, it lies between the ischial spine to the ischial tuberosity. It is called as a lesser sciatic notch. Next, third bone is pubis. The pubic bone is forms the anterior part. So it has a body and two oar-like projections, the superior rami and the inferior rami. The two pubic bone meet at the symphysis pubis and the two inferior rami from the pubic arch merging into a similar ramus and the ischium. So the space enclosed by the body of the pubic bone, the rami and the ischium is called as obturator foramen. Next, sacrum. Sacrum is a wedge-shaped bone consisting of 5 fused vertebrae. The upper border of the first sacral vertebrae is known as the sacral promontory. Anteriorly, it is hollow in nature, which consists of 4 fused vertebrae in which cauda equina pierces and supply the pelvic organs. Laterally, it has two oar-like projection, is called as alar wing. Posteriorly, it is rough in nature, which helps for the attachment of the muscles. Coccyx. Coccyx is a vestigial tail. It consists of 4 fused vertebrae forming the small triangular bone which articulates with the fifth sacral segment. So the function of this coccyx is it usually moves backward and gives space for the fetus to get descent during the labor process. Pelvic joints are, there are 4 joints, 2 sacroiliac joint, 1 symphysis pubic joint and 1 sacrococcygeal joint. Coming on to the pelvic ligaments, we have 5 important ligaments. Sacroiliac ligaments which supplies between the sacrum and the ilium, pubic ligaments which supplies between the pubis, then sacrotuberous ligaments which supply between the sacrum and the ischial tuberosity. Next, sacrospinous ligament which supplies between the sacrum and the ischial spine. Next, fifth one is the sacrococcygeal ligament which supplies between the sacrum and the coccyx. Types of pelvis. There are 2 types of pelvis, true pelvis and false pelvis. False pelvis is above the brim which is not involved in the labor process, whereas true pelvis which is involved in the labor process. It consists of, true pelvis consists of pelvic brim which is otherwise called as inlet, cavity and outlet. So before stepping into this inlet, cavity and brim, we should know the landmarks of this pelvic brim. So this pelvic brim consists of 8 main landmarks. So the landmarks are sacral promontory, sacral alar wing, sacroiliac joint, Iliopectineal line, iliopectineal eminence, superior rami of the pubic bone, upper inner border of the body of the pubic bone, upper inner border of the symphysis pubis. This is the image of the pelvic landmarks and all the 8 landmarks is pointed as 1, 2, 3, 4, 5, 6, 7, 8 for your reference. Pelvic cavity. So the cavity of the true pelvis extends from the brim superiorly to the outlet inferiorly. So the anterior wall is formed by the pubic bone and the symphysis pubis and its depth is 4 cm. The posterior wall is formed by the curve of the sacrum which is 12 cm in length. Pelvic outlet, it is a lower circumference of the true pelvis. It's very irregular. The space enclosed by it is called as outlet. Next is diameter of the pelvis. So the diameter of the pelvis include brim, cavity and outlet. So it has 3 principal diameter for brim, cavity and outlet. They are anteroposterior diameter, oblique diameter and transverse diameter. This is the image of a diameter of the pelvic rib. It depicts all the 3 diameters, that is anteroposterior, oblique and transverse diameter. Next is the diameter of the pelvis and this is the image. It depicts the diameters of the pelvis in all the 3 parts, that is on the brim, cavity and outlet. Here the brim is heart in shape, cavity is circle in shape, outlet is diamond in shape. So for the brim, anteroposterior diameter is 11, oblique is 12 and transverse is 13. Cavity is circle in shape, so all the 3 diameters are 12. Outlet is diamond in shape, so anteroposterior diameter is 13, oblique is 12 and the transverse diameter is 11. Coming on to the brief discussion about all the three diameters. First is the anteroposterior diameter. I have discussed you by showing the image. It extends from the sacral promontory to the symphysis pubis, and it has three conjugates. They are anatomical, obstetrical and diagonal conjugate. The anatomical conjugate measures 12 centimeter. It measures from sacral promontory to the upper point of the symphysis pubis. Obstetrical conjugate, it measures 11 centimeter. It is from sacral promontory to the posterior border of the upper surface of the symphysis pubis, which is 1.2 centimeter lower. Third is a diagonal conjugate. It is also measured anteroposteriorly from the lower border of the symphysis pubis to the sacral promontory, and it measures about 12 to 13 centimeter. Next, coming on to the oblique diameter in the pelvic brim. So there are two oblique diameter, right oblique and left oblique diameter. Right oblique diameter, it extends from the right side of the sacroiliac joint to the opposite side of the iliopectineal eminence. It is about 12 centimeter. Next, left oblique diameter, it extends from the left side of the sacroiliac joint to the opposite side of the right iliopectineal eminence. It is about 12 centimeter. Transverse diameter, it extends between farthest end of two iliopectineal line. It measures about 13 centimeter. Coming on to the second part of the pelvis, that is cavity. So cavity is circle in shape, so it measures about 12 centimeter. That is anteroposterior diameter, transverse diameter and oblique diameter. All three diameters are 12 centimeter in the cavity. Next, diameters of outlet. So as I told you earlier, the outlet is diamond in shape. So under this outlet, the anteroposterior diameter, it extends from the sacrococcygeal joint to the lower border of the symphysis pubis. It measures 13 centimeter. Next is the oblique diameter. As I told you earlier, it has two oblique diameter, right oblique and left oblique diameter. Right oblique, it extends from the right side of the sacrospinous ligament, that is the midpoint, to the opposite side of the left obturator foramen. It is about 12 centimeter. Left oblique diameter, it extends from the left side of the sacrospinous ligament midpoint to the opposite side of the right obturator foramen. It is about 12 centimeter. Next, the third diameter is a transverse diameter. It extends between two ischial spine. It measures about 11 centimeter. Types of outlet. So we have three types of outlet: anatomical, obstetrical and narrow pelvic straight. So anatomical outlet, it is covered with the all lower border of the pelvis along with the sacrotuberous ligament. Obstetrical outlet, it is a space between the anatomical outlet and the narrow pelvic straight. So the narrow pelvic straight, it is covered with all the lower border of the pelvis along with the sacrospinous ligament. Summary: the female pelvis is a strong and well adapted bony structure that supports the pelvic organs, including the uterus, bladder, and rectum, and it plays a crucial role in reproduction and childbirth. It is formed by ilium, ischium, pubis, sacrum, and coccyx. So the pelvis is divided into pelvic inlet, cavity, and outlet, which are important landmarks in assessing the progress of labor. The shape, size, and the type of pelvis influence the mechanism of labor and the ease of vaginal delivery. Knowledge of female pelvis helps in identifying the normal and abnormal pelvic structures, assessing the pelvic adequacy, and planning the appropriate obstetric care. Overall, understanding the anatomy of female pelvis is essential for BSc nursing students to provide effective care, safe and evidence-based maternal and reproductive health. Next is a conclusion. The female pelvis is a vital anatomical structure that plays a key role in supporting the pelvic organs and facilitating the childbirth. Its design is specially adapted to allow the passage of the fetus during labor. A clear understanding of a female pelvis enables nurses to assess the pelvic adequacy, recognize the abnormalities, and to manage the labor effectively. Thus, the knowledge of pelvic anatomy is essential for providing safe and competent maternal care. References: Thank you.